Hi, my name is Eva Steiner and this is my project Psychotherapists Around the Globe. I am interviewing the psychotherapists around the world and asking them the same 8 questions. I am wondering how mental health profession is in their country. Today we are going to... Thank you for taking this time for doing this interview with me. Before we start, can you tell me a little bit about yourself?
Okay, my name is Jarawan. I'm a clinical psychologist working, in Bangkok, Thailand.
Tell me a little bit about your culture. What is some holiday or traditions that your country celebrates? And if your culture would be an emotion, what emotion would it be?
The holiday that I would like to talk about is the Thai New Year. Basically, we celebrated our New Year in April. During mid-April, normally I think 13 to 15 of April. So basically, I think it's really important because it's very cultural and it's linked with the religious as well. That is the time where we, celebrate, where we kind of like prepare for the new beginning. In that Thai New Year, we'll have lots of cultural, rituals like going into the temple in the morning, giving food to the monks, asking, for blessings because we can start the year in the way that we can have a good luck, something like that. And it's time for the family as well because we tend to go back to the family, get together, and we use water as a symbol of kind of like blessing, purifying. So we kind of like pour the water into the elderly hands, asking them for, blessing, something like that. And in the afternoon, we just have kind of like water fight. That is, what happened during the Thai New Year.
Tell me more about this water fight.
The water fight, I think at the beginning because it's summer. So Thai New Year is the transition between the summer to the rainy season. So I think the weather during that time is really, really hot. So basically, I think the idea of, the water fight, I think is more like helping people kind of like getting, fun, reduce, the heat. I think that is the idea. But traditionally, I think we use the water as the way to, get the blessing, purify, and being kind of like friendly and happy toward each other. But I think in the modern years, we kind of like having fun, just splashing water to, everyone and just reduce the heat and enjoy it. I think it's really big events, around Thailand, like in the north, in Bangkok, and a lot of tourists come for the water fighting during the Songkran.
And you mentioned it's also linked to religion. Can you tell me more about that?
Basically, I think in our culture, Buddhist is really big religious in Thailand. So basically, we tend to just go into the temple, right, praying, and also use water. For example, during the Songkran, we kind of like pour the water on the Buddha statue to ask for blessing and also show respect to the religious as well. So basically, I think that is the time where people just go there, ask for merit, ask for kind of like, let me explain. It's more like, all the bad fortune is, disappear, would like to start the new year in the way that is refreshing. So basically, I think the Buddha images, the elderly are the people or, the symbol that we go to pay respect and, seek blessing from them.
And if your country would be an emotion?
I think when it's come to emotion, if you start thinking about the culture and everything, I think it's more like gentleness, showing respect and gratitude and care, and also fun and happiness. I think the surface, if you're looking at, the country, I think it's more like fun, smiley, happy. Okay, easy going, everything. We have a very typical face. We say everything is like no worries, might be like, so don't take it serious. So I think the emotion that you can see on the surface is more like a fun, happy, easy going, I think. But you will also see that they're very caring and they very respect the elderly.
How did you become a psychotherapist in your country and what is your therapeutic approach?
I actually work as a clinical psychologist and a psychotherapist. So basically in my path could be very different because I did started out with the clinical psychology degree. in Thailand. In Thailand, it's very different because we can pick which area in psychology that you want to do since undergraduate level, which is very different from other countries that you just do like a general, psychology degree. So basically, I picked clinical psychology in my undergrad, and then I moved to Australia to do my Doctor of Psychology degree. And then I came back to Thailand, 6 months internship to get license. And that is how I become a psychotherapist. But I think the path from other people could be very different because psychotherapist is not a protected title in Thailand. So if you get trained in counseling or psychotherapy, you can also work as a psychotherapist in Thailand as well.
Can you tell me a little bit more about this process? So it's not necessary for me to be a psychologist to do psychotherapy in Thailand?
Yes. So basically, I think in Thailand, we are very open. So basically, some people don't have background in psychology, but they continue their education in counseling or psychotherapy. Or some people like mental health professions. So basically, some nurses or maybe people in the medical professions, if they want to take training. In Thailand, we have lots of approaches. For example, like Satir, we have CBT certificate courses. We have those who do more like expressive art therapy. So basically, there are so many different ways that you can become a psychotherapist in the country.
And once you get this title, let's say that I become art therapist, can I work in a public institution or I can only work privately?
Right now, I think if you want to work in the public systems, there are some public systems that open for art therapists. But in private hospitals, I think you need to be registered because of, the HA hospital assurance, like the quality something. But I saw some therapists actually work in private hospitals, maybe under the supervision of the psychiatrist. In public hospital, we need someone with a license at the moment, but I think this will be a lot of changes because they started to discuss how we can certify the therapists in Thailand so people can work in the public systems. So if you become a psychotherapist, definitely you can work on private practice in your own setting, in your own clinic or company.
Then for a client, the help is available through public system or through private system?
Okay, if you're a client, actually we have like a, public health schemes that cover mental health services only in public systems. If you want to get to see a psychotherapist, who are not like a clinical psychologist that practice in the hospital, you need to self-pay. Some private health insurance cover mental health services, but not all of them. So you really need to check with the health insurance company. Mental health services in Thailand, I think, is very tricky because people need to, cover it themselves.
How society looks upon psychotherapy or any psychological help?
It's changed a lot in the last 20 years from what I've seen. I think if you ask about those who are in the older generations, baby boom generations, maybe they're not quite, understand why you need to go into talk. There are some people who suggest you just go and meditate, go to temple and things going to be better. You can talk to family, those kind of things, right? You don't really need to go to psychotherapist or get any psychological help. Some people still have a lot of, stigma because they think if you go and talk to psychotherapists, you are crazy. I think those ideas are still there, but I think it's become less and less in the younger generations. They are very open and they tend to come and talk to psychotherapists, not just because of their stress, they have psychological concern, but sometimes they just want to improve as a person. They have the goals that they want to achieve and they just want to maybe recheck, and help find someone to help organize the thoughts. You started to see that a lot in younger generations now.
Do you see elements of religion playing a part in a psychotherapy?
I try not to use religious in psychotherapy because I want to make it neutral, because you would not know whether, your patients or your clients are actually into religious or not. So I don't really want to touch on that issue in the therapy unless I really know that my clients really into the religious. It could be protective factor. It could be something, very, very helpful for them. So I tend to focus on my clients first. But I would say that right now into like the ACT acceptance commitment therapy. So that got some Eastern and Western elements. I would not say it's religious, but I think maybe some concept of mindfulness, Buddhist, that also in my practice.
Can you tell me more about the stigma? You mentioned if you go to a therapist, some people still think that you are crazy. Is there any other stigma there?
I think there's some kind of like implicit stigma. Sometimes people don't really show it, directly. But they might start wondering, if you go and see a therapist, what about your functions? Whether you're going to be okay in terms of, taking responsibilities. I think that is also another kind of stigma that we really need to be careful. So basically, when we need to write maybe the letter for, the clients to take to work, that they come to see psychotherapists, I think that is something that we need to be really careful, because even if people say it's open, mental health is health, but you don't really know what people think.
Well, you mentioned like, will a person be able to do these responsibilities? So I'm wondering, what is that? What is expected from an individual?
I think if it's come to work, if you talk about responsibility, sometimes they don't think that you will be able to, very kind of like big, high pressure responsibilities. Sometimes they wonder whether you could wake up in the morning, just something very simple. If you having mental health issues, can you wake up? Can you be on time? Can you be reliable? If you happen to be a student, we are not really sure whether you will be able to submit the assignment on time. And another thing is interpersonal relationship. Can you handle the emotion? Can you still relate to people normally? Group work. I think that's the issue. Sometimes people say, oh, I do understand. But when it's time to work with people who have mental health issues, they start wondering, should I or should not I? Yeah, I think it's something that we talk about responsibilities. Or another thing, when people know that, this person is a bit sad, talking to counselors, psychotherapists, or psychologists, they started to act in the way that is totally different. That is also stigma, try to care the person so much, asking you are okay, and try to overprotect them. So the person also feel like, I don't want to let anyone know because I don't want to get the special treatments. I'm still okay.
What is your society teaching about child-parent relationship, and whether this value of society also influence how you design your interventions as a therapist?
I think the relationship between child and parents very, challenging and interesting. It depends on, the generation of the parents and the child. So basically, I think if you start thinking about the parents who are in the baby boomer generations, they are very authoritative, they're very strict, use a lot of authority, very strict disciplines, and want their child to obey them without, any questions. And I think the way the discipline is more like a corporal punishment. So this is probably normal. If you do something, they spank you, they kind of like do some physical, punishment. It seems to be acceptable because that is how they discipline children, right? And in that generation, they don't think about this as maybe physical abuse or emotional abuse. It's more like a tough love. But I think if you started to see the younger generation's parents, they tend to practice more of positive parenting. We talk a lot about positive parenting, and they try to, make sure that the kids get support and care. I think that is how you started to see the relationship between child and parents. But one thing that I notice in the culture is we don't show much emotion when it's come to the child-parents relationship. And sometimes you will start to see the mixed messages in the relationship as well. Like the parents really caring, but they don't really express the words or maybe show the nonverbal language of, love and care. That is something that I notice quite a lot, that the open communication of feelings is still not happening. in most family.
And that goes for all the feelings, or just like pleasant, warm, loving feelings?
Pleasant, loving feeling. And I think if you really understand, the differences between, how the parents grow up and how the child expected, I think it's helped a lot when you started to decide the intervention, because I think it's a lot to do with the emotional needs, the attachment of the clients. So basically, when I start, seeing the clients who comes and talk about emotions, family conflict, communication issues, I think the way that you're looking at the relationship, how the parents grow up, how the, child expected, and also how they interact, I think it's helped a lot to start thinking whether you could help them with the struggles in which way.
Do they show care any other way, or why do you think it's that? Why do you think this emotion is not shown?
I think if you start thinking about the cultures, I think sometimes we are not showing emotions. It's more like action is, you will start to see some people say actions speak louder. I act, in the way that I care, and the way that they act in the way that they care is more like, disciplines, hard working, or maybe they just tell you what to do or what not to do. If you don't do it right, you need to get this and this and this and this as a consequences. I think it's more like, we communicate what is wrong, but we don't communicate what is right. And I think when it comes to emotion, people in the older generations, they just focus on work. They don't really actually, sometimes I think the way that you express emotion, you need to learn how to do that. And sometimes people feel uncomfortable saying nice things to each other, especially when you in the family. So basically, for example, the father, maybe they got shaped in the way that you need to be the leader of the family. You need to be tough. You cannot be weak. You cannot show, any side of emotion that link with weakness. You cannot be soft. So, sometimes parents are just like that. And the kids, sometimes they want to hear, for example, if you do something wrong, say sorry. And that's not happening. So basically, I think when this translates into therapy, I think when you really help the clients explore the emotion, what is lacking and what's the family normally react to them, I think in the way that when they start observe and they understand that maybe the language of love is very different. Maybe, the father, mother grow up in, the very different environment, different expectation. And sometimes they try to, show love, but maybe they could not do that. Because there are, some people who have difficulties expressing emotions, especially like, the older generations. I think when they have that awareness, and I think they can accept that, maybe they need to change the communication patterns.
And does this translate? So basically, you mentioned what the parent says goes, in this older generation. Does this translate to the therapy in a sense that the client expects from you that what you say, they will follow?
I think there are some clients I actually like that. So basically, some clients come and think that, the therapist is going to be the expert. So basically, whatever you say, they will really trust you and follow your direction, which you really need to be, careful. When I work, I'm very careful with that role. So basically, if I started to see that the patients come and start thinking about me as an expert, I think the first, sessions, we really need to make it clear that this is collaborative relationship and we are actually equal. And whatever, we discuss, or maybe the information that I give them, it can be maybe not quite right, or maybe not applicable for them. So basically, it's more like they need to be honest and really discuss if they think this is not okay, or if they think that they try but it's not working.
And if an adult client would come to you and say, I don't want to see my parents anymore, I want to cut contact, how would you approach as a therapist, and how would culture look upon such a request?
That's quite tricky, because the culture would say it's not okay. I think the culture is very family focused, and they expect that, you really need to go back and look after family. In Thailand, we still, have the collective mindset. I think the society will say that you should look after your family. Don't cut it. Family is family, father, mother, brother, sister, whatever, right? It's your family. But I think when it comes to therapy, we already know that. That's why the client's really stressed. because they can't really do what they want. So I think it's more like, help them explore emotional conflict and started to see how they're going to be able to move forward. In this case, I work in the way that I try to explore attachment, because I feel like when people say, I want to cut it off, maybe it's a lot more deeper, right? And I think there might be some patterns that keep hurting them again and again and again. So I try to explore attachment, background history, and what they think. And also the belief, the way they expect, the way they're looking at, the family situation as well.
What are the learned beliefs regarding client-therapist relationship? And can the relationship continue outside the therapy once the therapy process is over?
The first questions, I think, when it's come to the relationship between therapist and client, what I learned is the foundation for everything. Is the foundation skills that we really need to practice a lot during the training. And if you start thinking about the practical aspect, it's really, really helpful. So basically, if the clients, really trust you, if the therapeutic relationship is really good, it's actually a common factor for the effectiveness of the therapy, and it's really important for the change. So I think personally, I focus a lot on creating a strong, trusting therapeutic relationship. But outside the therapy, I won't, continue any kind of, relationship apart from professional relationship with the client, because I would say it's unethical.
And is there any law regarding that, or any organization where the client can turn to if there is therapeutic abuse, so that the therapist is the one that is abusive?
For clinical psychologists, because we are protected title, we have the license, so the clients can file the complaint to the organizations, and they can actually get protected as well. However, if you talk about other professions like psychotherapist, counselor, we are in the process of doing that in the country. So we are talking about how we can set up the standards, creating, a licensure. So the counselor and therapist got protected as well as the client as well. But right now, if the situation happens with other professions that is not clinical psychologist, I think the process is very limited.
And is supervision a must for a therapist in your country?
Not right now, but I think it will happen quite soon. I think supervision is a must if you still have in training, you don't get licensed yet. In the university, they require you to do, the client contact, how many hours, supervision, how many hours is really clear. But after you get the license for clinical psychology, it's not a requirement to, renew your license. For counseling and psychotherapy, I think if you, get into the course, it's requirement. But in Thailand, when you practiced, it's not the requirement. But I think they started to do the process of giving the certification process. I think it will be there that you require a certain number of supervision hours to continue the license as well. But practically, we do have supervisions, even though it's not required by the law or any organizations. But I think practically we do have supervision.
What are the most common complaints that the client comes to therapy for?
My workplace is private hospital. So basically the complaint that I got is, mental health issues, depression, anxiety, panic, attack, OCD, bipolar. So basically that is the common, referrals for me. Relationship, work, burnout.
If you would share one tool, belief, or approach that is a must-have for you as a therapist, what would that be?
I got training in CBT, and then, I started to move from the traditional CBT to ACT, to acceptance commitment therapy, the third way of the mindfulness. So basically, if I feel like the tool that I really like, I think it's still in the CBT approach is behavioral activation. I think I really like that because it gives the clients more the structures into what they really need to do. So I think behavioral activations can be very useful with those who are very depressed, but it's also very useful when it's come to people who have a lot of anxiety, or when they started to, have emotional roller coaster up and down. I think when behavior activation happen is give like a structures in life, and when you mix with the new concept like ACT, you can start to set the activities in the value based. So basically, I think it's very practical, applicable, and I think it's more like a foundation for other things, other technique that I can use as well.